A triple threat of viruses causing concern for people across the nation: COVID and monkeypox, and now polio. Local doctors say while cases of COVID and monkeypox are confirmed in Mississippi, it's important to stay alert for all three. Patrice Clark has the story.
The coronavirus, monkeypox, and now polio. Dr. Stephen Threlkeld says just the thought of the three making people sick can be scary.
It is not anything new in our world or in our society to have new infections that jump, particularly from animals over into people. And that seems to be what we have experienced in both COVID and in monkeypox. And then, unfortunately, some of the things, just all of the confusion, some of the controversy in science and recommendations have led people to be under-vaccinated. And it's particularly tragic when you have a disease like polio that was nearly eradicated from the earth.
The coronavirus is highly contagious and continues to spread mainly through person-to-person contact. And monkeypox is a rare disease caused by infection with the monkeypox virus. Health officials say transmission can occur with close skin-to-skin contact, such as kissing, cuddling, or sex with an infected person. It causes flu-like symptoms such as a fever and chills, followed by a rash that turns into pimples and blisters. It can take weeks to clear, and some cases have already been identified here in the state. And then there is polio. No cases have been confirmed in Mississippi, but it has re-emerged in New York, with the Department of Health officials confirming the presence of the virus in wastewater. New York also identified the first person in nearly a decade in the U.S. to be diagnosed with polio. It is transmitted through contaminated water and food or contact with an infected person.
It is true that the likelihood right now in America is still low of getting polio, but the way to change that, unfortunately, and make it a higher likelihood is for people not to be adequately vaccinated. So if we just do those simple things that we know work, I mean, to have fully approved and long-standing vaccines given to our kids and to appropriate boosts to adults, if we just do those things, then we should be protected against the vast majority of these things.
Patrice Clark, 3 on your side.